The first thing you reach for in the morning isn't your phone or your glasses. It's water. Because your mouth is so dry, it feels like something left a layer of chalk on the inside of your cheeks overnight. Your lips are stuck together slightly. Your throat has that scratchy, tacky feeling that takes a few swallows to clear. You drink, you feel better, and within 20 minutes, you've mostly forgotten about it. Until tomorrow morning, when it happens again. Most people who experience this put it in the same mental folder as stiff joints and needing more light to read. Annoying, manageable, probably just part of getting older. I want to respectfully push back on that. Waking up with a dry mouth every single morning is not just an inconvenience. In many cases, it is the body's way of pointing at something specific, something that deserves attention, not because it's necessarily dangerous right now, but because of what it can quietly lead to if left unexamined.
And some of those things, I'll tell you honestly, surprised me when I first started connecting the dots years ago. So stay with me, because this is one of those symptoms that sounds minor and turns out to carry more information than people expect. Let me start by being clear about what we're not talking about. Waking up with a slightly dry mouth after breathing through your mouth on a cold night, or after an evening where you didn't drink quite enough water, that's not what I mean. That's circumstantial. It changes night to night. It makes sense when you trace it back. What I'm talking about is consistent morning dry mouth. The kind that's there most mornings, regardless of how much you drank the day before, regardless of the season, regardless of whether you slept on your back or your side. The kind that has become so routine that you no longer really notice it anymore. It's just the first sensation of every day. That pattern is a signal, and signals deserve to be read. The medical term for chronic dry mouth is xerostomia, and while it sounds obscure, it's actually quite common in people over 60. Not because dryness is a natural inevitability of aging, but because of a cluster of specific causes that become more prevalent in this stage of life. Understanding which cause is driving it is the difference between managing a symptom and actually addressing the source. The single most common cause of chronic morning dry mouth in people over 60 is medication. And I want to spend real time here because I think this is where the most people will recognize their own situation. There are over 500 medications that list dry mouth as a known side effect. 500! That number still gives me pause when I say it out loud, because it means that virtually anyone taking multiple prescriptions, which describes most people in their 60s and 70s, has at least some medication-related contribution to salivary gland suppression. But some categories of medication produce this effect far more consistently and severely than others. Antihistamines, both prescription allergy medications and over-the-counter options like diphenhydramine, the active ingredient in many sleep aids, including ZzzQuil and Benadryl, are among the most potent suppressors of saliva production. They work by blocking a class of receptors called muscarinic receptors, and those same receptors happen to govern salivary gland activity. So when you block them to control allergy symptoms or to get drowsy at bedtime, you also tell your salivary glands to slow down significantly. Many people take these medications every night for years as a sleep aid, never knowing that what they're waking up with every morning is a direct pharmacological consequence. Blood pressure medications, particularly certain diuretics and some alpha blockers, reduce fluid levels in the body systemically, including saliva. Antidepressants, especially older tricyclic antidepressants and some SSRIs, are strongly associated with dry mouth. Bladder medications used for overactive bladder, like oxybutynin and tolterodine, are among the worst offenders because they're specifically designed to reduce fluid secretion in the urinary tract, and they reduce it in the salivary glands too. The reason this matters beyond the discomfort, and I'll come to this in a moment, is that saliva is not just moisture. Saliva is doing something. It's neutralizing acids in your mouth. It's containing enzymes that begin digestion and protect the tissue. It's providing a mechanical wash that keeps bacteria populations in check. When saliva production drops significantly, the consequences extend well beyond a dry feeling in the morning. If you take any of the medications I mentioned, please don't stop them on your own, but do bring this specific symptom to whoever manages your prescriptions. There are often alternatives within the same drug class that have a lower anticholinergic burden, meaning they do their job with less impact on salivary glands. Sometimes simply adjusting the timing of a medication changes the overnight effect considerably. Now, here's the connection that most people genuinely don't expect: sleep apnea. I've mentioned sleep apnea in other conversations because it is one of the most underdiagnosed conditions in this age group, and its effects reach into almost every corner of health. But the connection to dry mouth is particularly direct, and it's one of the most reliable clinical clues I use when evaluating this symptom. When the airway partially or fully obstructs during sleep, the body compensates by breathing through the mouth. Mouth breathing is profoundly desiccating. Air flows across the oral tissue for hours without the filtering and humidifying function of the nose, and saliva evaporates far faster than it can be produced during the reduced salivary activity of sleep. The result is that people with undiagnosed sleep apnea often wake up every single morning with severe dry mouth, sometimes so dry that their tongue feels slightly swollen or their throat feels raw. They may also wake with a headache, feel unrested despite adequate time in bed, and be told by a partner that they snore or seem to gasp occasionally. But here's what makes this tricky. Not everyone with sleep apnea snores loudly. Not everyone has a partner who notices. Some people sleep alone, sleep quietly, and have no idea that their airway is collapsing dozens of times a night. They just know that they're tired in the morning and their mouth is a desert. Dry mouth that is worst first thing, that is accompanied by any morning headache, any significant daytime fatigue, or any sense of unrefreshed sleep, that combination should prompt a specific question to your doctor about sleep apnea evaluation. A home sleep test is simple, affordable, and can be done entirely in your own bed. There's a third cause I want to raise, and it's one that people rarely associate with the mouth at all: blood sugar. When blood glucose runs higher than it should, in undiagnosed or poorly controlled diabetes, or in the very common state of prediabetes that precedes a formal diagnosis, the kidneys work overtime to filter the excess sugar from the blood. They pull extra water into the urine to do that. The result is increased urination and a corresponding drop in overall body hydration. That systemic mild dehydration shows up in multiple ways: increased thirst during the day, more frequent urination, and very commonly, especially overnight when fluid isn't being replaced by drinking, a pronounced dryness in the mouth by morning. What makes this particularly important is the broader context. If you're waking up with a dry mouth, and you're also getting up 1 or 2 extra times at night to urinate, and you've noticed increased thirst during the day that feels slightly out of proportion to what you're drinking, that cluster of symptoms together deserves a fasting blood glucose check and an A1C test if you haven't had one recently. I've had patients who discovered their diabetes through a dry mouth conversation, not because the dry mouth was their most prominent symptom. They had others they'd been attributing to different things, but because that morning dryness was what finally prompted the visit that connected all the dots. The body is consistent. When something is going on systemically, it usually speaks in multiple places at once. The skill is in listening to all of them together. Now I want to talk about what happens when dry mouth is left unaddressed over time, because I don't think people fully appreciate the downstream consequences. Saliva does several critical jobs in the mouth simultaneously. It contains antibacterial compounds that keep certain microbial populations in check. It's slightly alkaline, which neutralizes the acids produced by bacteria after you eat. It provides a physical cleansing action that removes food particles and bacteria from tooth surfaces between brushings. And it contains minerals, calcium and phosphate, that are continuously being deposited back into enamel, keeping teeth remineralized and resistant to decay. When chronic dry mouth reduces saliva production significantly, all of those protective mechanisms diminish. Acid levels in the mouth stay elevated longer after eating, bacteria proliferate in the drier environment, the tooth surface becomes more vulnerable. The clinical result is a pattern of dental decay that's quite specific, often at the gum line and on root surfaces that were previously protected by receded gum tissue, in people who have maintained otherwise good dental hygiene for decades. Their brushing habits haven't changed, their diet hasn't changed, but suddenly, at 65 or 70, they're developing cavities in places they never had them before. I've had patients genuinely confused by this. They take care of their teeth, they always have, and their dentist is finding problems that weren't there 2 years ago. When I ask about dry mouth, they confirm it immediately. And when we trace it back to a medication that was started around the same time the dental problems began, the connection becomes clear. Chronic dry mouth also increases the risk of oral infections, including a fungal infection called oral thrush that's more common in older adults than most people realize. It contributes to difficulty swallowing, to changes in taste, and to problems with speech that some people notice, but attribute to other things entirely. This is not small. The mouth is the entry point to the body. What happens there ripples outward. There's one more cause I want to mention before we get to practical steps: autoimmune conditions, specifically a condition called Sjogren's syndrome. Sjogren's is an autoimmune disorder in which the immune system mistakenly attacks the moisture-producing glands, primarily the salivary glands and the tear ducts. It causes severe dry mouth and dry eyes, often in combination. It affects women far more commonly than men, and it can present at any age, but is frequently diagnosed in women in their 50s and 60s, often years after symptoms first appeared. The reason I bring this up is that Sjogren's is significantly underdiagnosed. Many people who have it have been managing the dry mouth and dry eyes for years, using eye drops, drinking more water, keeping lip balm nearby, without anyone ever connecting those two symptoms and considering an autoimmune cause. If you have persistent dry mouth and you also experience persistent dry eyes, not just occasional dryness, but a chronic, gritty, or burning sensation in your eyes, please mention both symptoms together to your doctor, specifically in the same sentence. That combination should trigger an evaluation for Sjogren's, which involves specific blood tests and possibly a minor salivary gland biopsy. Sjogren's is a manageable condition. It is not a sentence, but it does benefit from proper identification and treatment, rather than years of quiet, unaddressed discomfort. Let me bring this to something practical, because that's always where I want to end. Talk to your pharmacist or doctor about your medication list with this specific symptom in mind. Ask whether any of what you're taking is known to suppress saliva or has anticholinergic properties. Ask whether alternatives exist. Ask whether timing adjustments might help. This is a specific, answerable question, and the answer may be simpler than you expect. Hydration during the day supports nighttime saliva production in ways that matter. The salivary glands, like all glands, function best when the body is adequately hydrated. Not excessive hydration, which leads to multiple overnight bathroom trips, but consistent, steady intake throughout the day. Finishing most of your fluid intake by early evening reduces sleep disruption while still supporting adequate hydration. Mouth breathing during sleep can be addressed, sometimes simply. A humidifier in the bedroom raises ambient moisture and reduces overnight desiccation significantly. Nasal strips that gently open the nasal passages can shift breathing back through the nose for some people. For those in whom mouth breathing is being driven by sleep apnea, treating the apnea addresses the dry mouth directly. For immediate morning relief, there are saliva substitute products, sprays and gels, that provide overnight moisture in a way that plain water doesn't, because they have a slightly thicker consistency that coats the tissue. Biotene is a well-known brand. These are not cures, but for people whose dry mouth causes significant overnight discomfort, they can meaningfully improve quality of sleep and morning comfort. And please, tell your dentist. If you're experiencing chronic dry mouth, your dentist needs to know, because they can apply fluoride treatments specifically targeted at the root surfaces that are most vulnerable in a dry mouth environment, and they can monitor you more closely for the early signs of decay that are easily addressed when caught early and much harder to manage when they're not. Here's what I want you to walk away with. Dry mouth every morning is not trivial. It is not simply the price of getting older. It is information, specific, actionable information about something your body is experiencing that deserves a conversation, not continued accommodation. Whether the cause turns out to be a medication that can be adjusted, sleep apnea that can be treated, blood sugar that can be better managed, or an autoimmune process that can be properly addressed, every one of those paths leads somewhere better than where you are now, and none of them are accessible if the symptom stays in the minor inconvenience folder. The patients I've seen resolve their chronic dry mouth, sometimes after years of simply living with it, describe the difference in their mornings, their dental health, their sleep quality, and occasionally their overall energy in ways that genuinely moved me. Not because it was dramatic, because it was so long overdue. Small symptoms, taken seriously. That's where good health is protected. Tell me in the comments, is this your morning? That first reach for water every single day? Have you mentioned it to a doctor, or has it been one of those things you've been quietly managing around? And if you noticed something specific in what I described today that sounded familiar, the medication connection, the sleep apnea, the blood sugar piece, share that too. Where are you watching from? I always enjoy knowing. If this raised questions about your medications or your sleep, there's another video here that goes deeper into sleep apnea specifically, and the ways it quietly affects health in people over 60 in ways far beyond just snoring. It's directly connected to what we talked about today. Take good care of yourself. And tomorrow morning, when you reach for that glass of water, remember that your body is telling you something. It's worth finding out what.